Hello everyone, welcome to Smart Seniors channel. Here, the wisdom of nature comes alive. Discover powerful natural remedies today for a healthier tomorrow. If you found today's video helpful, stay healthy, stay smart, and don't forget to like, share, and subscribe for more healthy living tips so you'll be the first to see our upcoming videos about healthy living. In today's video, we'll talk about a very important topic, bronchial asthma. Asthma is a chronic respiratory disease where the airways become inflamed and narrowed, making it difficult to breathe. Coughing, chest tightness, and wheezing are some of the main symptoms. Although asthma cannot be completely cured, it can be controlled, allowing people to live a full and active life. First, let's understand how asthma develops. Then we'll discuss its symptoms, triggers, and treatment options, which will make it easier to manage. How does asthma develop? Two main factors play a role in asthma. 1. Genetic factors. If asthma or allergies run in the family, the risk is higher. 2. Environmental factors. Dust, polluted air, smoke, and infections. People with asthma have sensitive airways that narrow easily, even from minor triggers. Knowing the symptoms and avoiding triggers can greatly improve quality of life. Main symptoms of asthma. Asthma usually appears with the following signs: shortness of breath, wheezing or noisy breathing, persistent dry cough, often at night or in the morning, chest tightness or pressure, symptoms worsening after exercise or exposure to allergens. As you can see, these symptoms can make daily life challenging. Recognizing and treating them is crucial. Asthma triggers. Common triggers include allergens, dust, pollen, pet hair, mold infections, cold, flu, bronchitis, environmental factors, cold air, smoke, pollution, physical activity, running or intense exercise, stress and emotional strain, certain medications, aspirin, beta blockers. Once we know the triggers, we can also look at different types of asthma, since treatment and prevention vary. Types of asthma. Asthma can occur in different forms. 1. Allergic asthma. 2. Non-allergic asthma. 3. Childhood asthma. 4. Adult onset asthma. 5. Occupational asthma. Knowing the type helps doctors plan treatment and advise on avoiding triggers. Severity of asthma. Asthma can be mild, moderate, or severe. Mild symptoms appear rarely. Moderate, frequent shortness of breath, especially at night. Severe symptoms occur almost daily, requiring more medications. Understanding severity helps in managing asthma and knowing what to do during an attack. How is asthma diagnosed? Doctors diagnose asthma using patient complaints and medical history. Spirometry measures lung volume and airflow. Peak flow meter monitors lung function and attacks. Allergy tests identify triggers. Once diagnosed, the next step is treatment and lifestyle management. Treating asthma. Even though asthma cannot be fully cured, it can be controlled. 1. Medications. Rescue inhalers for immediate relief during attacks. Long-term medications reduce inflammation and prevent attacks. 2. Lifestyle management. Avoid allergens, quit smoking, maintain cleanliness at home, regular moderate exercise, healthy diet and stress management. During an asthma attack. 1. Stay calm and don't panic. 2. Use a rescue inhaler. 3. If symptoms persist, call your doctor or emergency services. Correct action during an attack can save your life. Preventing asthma. Avoid dust and allergens. Protect yourself from colds and flu. Regular checkups with your doctor. Maintain a healthy lifestyle. Next, let's look at foods that help and harm asthma, because diet can also ease symptoms. Beneficial foods for asthma: foods that expand airways, reduce inflammation, and boost immunity. Green vegetables, broccoli, spinach, fish, salmon, sardines, mackerel, apples protect lungs with quercetin and vitamin C. Citrus fruits, rich in vitamin C and bioflavonoids. Nuts and seeds, sources of omega-3 and magnesium. Garlic and onion, natural antibiotics. Ginger relaxes airways. Sweet potatoes, beta-carotene and vitamin A. Avocado, legumes, bananas, berries, milk and yogurt. Turmeric. These foods protect airways, reduce inflammation, and strengthen immunity. Harmful foods for asthma. Some foods can worsen asthma symptoms. It is red meat, sweets and white flour products, fatty dairy, fried foods and fast food, soda and energy drinks, alcohol, sausages and processed meats, chocolate and caffeinated products, tobacco smoke. The most dangerous factor: harmful foods narrow airways, trigger allergies, and increase attack risk. Of course, proper nutrition plays an important role in reducing asthma symptoms. Let's take a closer look at the top 5 natural products beneficial for asthma and their benefits. Top 5 natural foods for asthma. 1. Apples. Key nutrients: flavonoids, quercetin, vitamin C, fiber. Benefits: quercetin reduces inflammation in the lungs. Vitamin C protects airways from free radicals. Studies show regular apple eaters have fewer asthma symptoms. Extra benefit: boosts immunity and helps fight allergies. Apples are considered a natural remedy for protecting the respiratory tract and reducing inflammation. Therefore, it is recommended to include them in a regular diet for those struggling with asthma. 2. Citrus fruits. Key nutrients: vitamin C, bioflavonoids, potassium. Benefits: reduce lung inflammation and strengthen airways, minimize allergic reactions, help prevent attacks triggered by cold or infections. Extra benefit: boosts overall immunity. It supplies the body with vitamins and increases overall immunity. Therefore, fruits like oranges, lemons, and grapefruits are beneficial for respiratory health. 3. Garlic and onion. Key nutrients: sulfur compounds, allicin, flavonoids. Benefits: strong anti-inflammatory effect, open airways and reduce bronchial spasms, thin mucus for easier clearance. Extra benefit: fight infections and prevent asthma triggered by colds. Adding garlic and onions to daily meals naturally helps reduce asthma attacks. 4. Ginger. Key nutrients: gingerol, shogal, essential oils. Benefits: relax bronchial muscles and widen airways, reduce inflammation and ease symptoms, thin mucus and relieve cough. Extra benefit: strengthens immunity and helps during colds and flu. Adding ginger to tea or mixing it in dishes can be effective in fighting asthma. 5. Sweet potatoes. Key nutrients: beta-carotene, vitamins A and C. Benefits: beta-carotene converts to vitamin A, protecting lung lining, reduces airway sensitivity and allergic reactions. Powerful antioxidant to reduce inflammation. Extra benefit: supports immunity and balances blood pressure. Sweet potatoes are very beneficial for people with asthma as a natural anti-inflammatory product that protects the respiratory tract. Summary: apples and citrus, rich in vitamin C, protect lung cells. Garlic and onion, natural antibiotics, open airways. Ginger widens bronchi, eases mucus. Sweet potatoes, vitamin A and beta-carotene strengthen lung lining. General conclusion: asthma is a chronic but controllable disease. Even though it cannot be completely cured, with the right treatment, lifestyle changes, and healthy nutrition, people with asthma can live a normal, active, and fulfilling life. Knowing the symptoms and triggers helps prevent severe attacks. Medications and inhalers provide effective control. A healthy diet with apples, citrus fruits, garlic, ginger, and sweet potatoes can reduce inflammation and protect the lungs. Avoiding harmful foods, smoking, and pollution is equally important. In short, with proper care, asthma does not have to limit your life. It can be managed successfully. Thanks for watching. What topic would you like us to cover in our next video? Leave your ideas in the comments. We'll create a video on the most requested topic just for you. If you found today's video helpful, don't forget to hit that like button and share it with your friends. And of course, make sure to subscribe so you'll be the first to see our upcoming videos about healthy living. Your opinion means a lot to us. Stay healthy and stay with us.